Our topic for today is air leak. जब भी ट्रैक्योब्रोंकियल ट्री से कहीं भी इंजरी हो और हवा रिसने लगे, इसको हम एयर लीक बोलते हैं। तो अभी हमको देखना है कि व्हाट इज एयर लीक एंड टाइप्स ऑफ एयर लीक। तो एयर लीक कहीं भी ट्रैक्योब्रोंकियल ट्री में इंजरी है तो जो इनकमिंग एयर है वो बाहर जाने लगेगी और प्लूरल कैविटी में एक्यूमुलेट हो जाएगी, इसी को हम एयर लीक कहते हैं। ओके, नेक्स्ट इज एयर लीक के टाइप्स. So this is a trachea. So this is trachea. This is left main bronchus or primary bronchus. This is the upper lobe bronchus or secondary bronchus or lobar bronchus. This is lower lobe bronchus, secondary bronchus or lobar bronchus. After lobar bronchus, we have tertiary bronchus or segmental bronchus. सो जो भी इंजरीज ट्रैक्योब्रोंकियल ट्री में प्रॉक्सिमल टू द टर्शियरी ब्रोंकस होगी, मीन्स लोबार ब्रोंकस, मेन ब्रोंकस और ट्रैकिया, जो भी प्रॉक्सिमल टू द टर्शियरी ब्रोंकस होगी या प्रॉक्सिमल टू द सेगमेंटल ब्रोंकस होगी, इसको हम बोलेंगे BPF, ब्रोंकोप्लूरल फिस्टुला। इसकी खास बात क्या होगी, इसमें अमाउंट ऑफ एयर लीक ज्यादा होगा एंड जो भी इंजरीज डिस्टल टू टर्शियरी ब्रोंकस होगी या फिर डिस्टल टू सेगमेंटल ब्रोंकाई होगी, इसको हम बोलेंगे प्लूरो एल्वियोलर लीक, एल्वियोलर लीक, PAL और AL. So we are going to read three types of leak. The first is alveolar air leak or pleuroalveolar leak. This will be distal to the tertiary bronchi or segmental bronchi. Distal to tertiary bronchi or segmental bronchi. Parenchymal air leak distal to segmental bronchi. 50 to 65% of lung resection surgeries में जो लीक्स होती है ये प्लूरोएल्वियोलर लीक्स होती है. ओटी टेबल पे हम इसको कैसे कंफर्म करते हैं, बाय वाटर पंक्चर टेस्ट. दिस इज परसिस्टेंट एयर लीक. परसिस्टेंट एयर लीक हम कब कहेंगे, जब जब भी कोई एयर लीक हो और वो 7 to 10 days से ज़्यादा परसिस्ट करती है. नॉर्मली जो एल्वियोलर लीक होती है ये एक हफ्ते में बिल्कुल कम हो जाती है, विदिन लेस देन 7 days ये अपने आप बंद हो जाती है, क्योंकि ये प्लूरल सर्फेसिस से होती है, डिस्टली होती है, डिस्टली टू द सेगमेंटल ब्रोंकाई एंड दे क्लोज ऑन इट्स ओन. और जब ये 7 to 10 days में बंद ना हो तो हम इसको बोलेंगे परसिस्टेंट एयर लीक. परसिस्टेंट एयर लीक में 3 क्राइटेरियाज हैं. प्रोलॉन्ग एयर लीक ग्रेटर देन 7 to 10 days, फ्लो ग्रेटर देन 20 ml per minute in 24 hours. जब भी एयर का जो फ्लो हो वो 20 ml per minute पर 24 आवर्स हो तो ये परसिस्टेंट एयर लीक की तरफ इंडिकेट करेगा. ग्रेटर देन 200 ml per minute इन 5 days और इंस्टेंटेनियसली आफ्टर सर्जरी. आफ्टर सर्जरी अगर एयर वॉल्यूम 200 ml से ज़्यादा है पर मिनट किसी भी दिन या फिर अगले 5 दिनों तक अगर इतना है तो इसको हम कहेंगे परसिस्टेंट एयर लीक। इंसिडेंस कितना है, 9.5 to 15% जो होता है ये परसिस्टेंट एयर लीक होता है। नाउ व्हाट इज बीपीएफ? फ्रॉम सेगमेंटल ब्रोंकाई अपवर्ड्स। सेगमेंटल ब्रोंकाई से जो भी प्रॉक्सिमल इंजरीज होंगी उनकी वजह से जो भी एयर लीक होती है उसको हम बीपीएफ कहते हैं। तो प्राइमरी, सेकेंडरी और टर्शियरी ब्रोंकाई टू प्लूरल कैविटी जब भी एयर लीक करेगी तो इसको हम बीपीएफ कहेंगे। So what are the grading of air leak? Two types of grading. One grading was given by Machirini et al. And Serfolio grading. Serfolio grading सबसे ज़्यादा यूज होती है and another grading by Machirini et al. 0, 1, 2, 3. There are 3 grades in Machirini grading. In grade 0, there is no visible air leak. In grade 1, there are countable bubbles. You can see 1, 2, 3, 4, 5. You can count the bubbles. So grade 1 is countable bubbles. Grade 2 is you will get a stream of bubbles. And grade 3, you will get collaged bubbles. So these are gradings in Machirini grading system. And this is Serfolio grading system. इसमें हमको 4 grades मिलती हैं. Grade 1 on you will get bubbles on forced expiration. Forced expiration means cuff. On cuffing, you will get air leak, visible air leak on cuffing. Second is you will get bubbles on expiration. Third is you will get bubbles on inspiration. And fourth is continuous bubbling both on inspiration and expiration. Inspiration and expiration में जब ये दोनों में आपको मिलेगा तो इसको हम बोलेंगे grade 4 Serfolio grading. So we'll quickly try to read. What are the intraoperative strategies to avoid air leak? First is the water. We do after every thoracic surgery the water submersion test. We fill the thoracic cavity with normal saline. जहाँ से भी air leak होगा उसको हम या तो Prolene sutures या फिर different methods से उससे repair करेंगे. Good surgical और दूसरी सबसे important चीज़ है good surgical technique. Gentle handling of the tissues, dissecting along the tissue planes so that there is less bleeding, less trauma, and minimal use of cauteries, and if possible use of harmonic, surgical repair of the leaks, proper adhesiolysis, do not try to tear the lung, proper mobilization and adhesiolysis. You can use blood or pleural patch for the closure of the air leaks and follow complete decortication procedure. Do not leave anything. Third is what we can do is pleural tenting. Fourth is you can also do diaphragmatic paralysis by using either marking or phrenic crush so the diaphragm comes a bit up and the thoracic cavity gets rest. Pleurodesis. You can also use muscle flaps. Example, serratus anterior muscle flap and the intercostal muscle flap. Proper placement of the chest tube is very important. 2 drains are important. 28 number. Good fixation of the drains so that proper air gets drained, air and all the collection gets drained. What are the sealants that are used? Use of surgical sealants. Surgical sealants use करने में कुछ बातें जो बहुत ज़्यादा important है ये कि it should be cost effective. It should have a very good sealing property and serve the purpose for which it is used, and apply sealants on expanded lungs. Do not apply on a collapsed lung, use it on an expanded lung. Use sealant on expanded lung. What are the type of sealants that are used in surgery? First one is we use fibrin glue. Second one is the autologous fibrin sealant. Tacoseal proactive sealant, Progel, BioGlue, Fibrinogen. These are the list of sealants that you can use after thoracic surgery, and CoSeal. Some of them are example Progel. This is US FDA approved. BioGlue from bovine serum glutaraldehyde. Fibrinogen formed by TISSEAL. It is called as TISSEAL. CoSeal is the polymeric hydrogen. CoSeal, TISSEAL, BioGlue, ProGlue, and Tacoseal. These are the very important sealants. You can have a list of all these things. And delivery of sealant, there are 2 methods, drip method and the spray method. You can use either of them. There are few post-operative strategies to avoid air leaks. Try to extubate patient on table. If possible, take a chest X-ray in recovery. Use portable suction drains so that patient can walk, mobilize as early as possible. Topaz is the digital suction device that you on a daily basis. Drain on suction, you can keep drain on suction and its value should be 2 kilopascal, not more than that. So it will give a suction effect and also allow closure of the drainage of the fluid and the closure of the air leaks. Early mobilization of the patient, usage of incentive spirometer, suction, and after 2 to 3 days, you will see subtle air leaks heal on their own and major air leaks within 48 hours. If they precipitate, it is mainly from the bronchus, bronchial air leak. Take the patient to the OT and repair the leak. What are the problems that you get with the air leak? First is pain. Second is infection due to ICD. Due to prolonged ICD, you will have pain and there is a risk of infection. It will decrease the mobility if you have prolonged ICD. There is increased risk of DVT or pulmonary embolism as the patient is restricted to the bed if he is on prolonged intercostal drainage system. Need for mechanical ventilation or fluorodesis procedures, increased need of ICU stay, increased need of hospitalization. It increases the cost, psychology of the patient and increases the ICD time. So these are the problems with the air leak. So you should not have air leak